and lovely to be here at the Health Coalition Aotearoa political panel. I'll just run through how this is going to work. We're going to hear from each of the spokespeople for about 5 to 10 minutes, and this will be focusing on their, response and in some ways their vision and their ideas around those prevention policy priorities which the Health Coalition Aotearoa has come up with. You'll have that document hopefully on your seat somewhere. You'll be able to have a look at that and see just where some of the parties are sitting or not sitting, or whether they're sitting on the fence on some of those issues which have been highlighted by the Health Coalition Aotearoa. So about 5 to 10 minutes from each. We'll go in the order of political party size, just as no particular reason, but that's just an easy way to do it. I'll start that shortly. Just a reminder about questions. So once we've done that, we will then have a Q&A session, and this is the really exciting part, and it will be using the Slido app. Now you should have a piece of paper like that on your chair as well. You can scan the QR code, it'll take you to the Slido app, and there, once you've got your Wi-Fi or your whatever, you'll be able to put in questions, and they will be then come through to me and I can read them out. And the reason for doing that is this is being recorded so people afterwards can watch it and they can see it back, and that is an easier way to do it. If you're having trouble and you've got a burning question that you really, really want and it's not working for you, or your phone doesn't work or something, sneak up the side here and talk to one of us up here and we'll make it happen. We'll make sure your question gets in somehow if we can. They will be moderated to some extent, so I can't guarantee that all the questions will get through, but I'll certainly do my best to get them through. We'll have the Q&A session, then there will be a chance for a morning tea and a kai afterwards, and a little bit more of a chat. So let's kick things off then, and we'll start with Dr. Ayesha Verrall, who of course is the Minister, and hear from her. If she would come forward, I don't know if you're able to speak up, a lectern would be probably better. Dr. Verrall.
Tēnā koutou katoa, and what a pleasure it is to be here with you. Thank you, Lisa and Boyd, for your work with Health Coalition Aotearoa to bring this event together and to profile the importance of a topic very dear to my heart, public health before the election. Welcome also to my fellow candidates. This must be one of several similar forums we'll have in the coming weeks. Look, if I reflect back over the last 3 years, what a long way we have come. 3 years ago, I was an infectious diseases doctor at Wellington Hospital, desperately concerned about the state of our contact tracing situation as we faced a global pandemic. At that stage, I responded as a clinician and an expert to that situation, but it led to me getting into politics, and somehow, in a sequence of events that I cannot quite explain, I am now Minister of Health. Nonetheless, I think if we think back to that time, what have we in the public health community achieved? Well, we stared down an incredible pandemic. Our actions in the first 2 years of the pandemic probably is estimated to have saved 20,000 lives. We did that by mobilising all the resources of government to address the threat of the pandemic at the border and managed isolation in the communities. We strengthened our public health infrastructure in the course of doing so. I won't deny it was an incredible challenge, not just for government, public health and our health services, but actually for our whole community. But I also think that we can be incredibly proud of what we achieved through that. Now that is part of the public health legacy of the Labour government, and it is one of which I am tremendously proud and grateful to those parties that also, during the beginning of the pandemic, supported those initiatives, because that was the responsible thing to do. Recovering from our pandemic, though, has brought to light a lot of the long-term health challenges that our country has grappled with for decades, but has in some ways made them more acute. We have been incredibly active in addressing some of these long-standing issues in public health. One of the ones I am proudest of, and I want to thank you for your contribution to, as Health Coalition Aotearoa, is the Smoke Free 2025 legislation. Now, the smoke-free movement has been a long-standing movement in New Zealand, but I'm proud that we have made world-leading legislation to make a smoke-free generation, to control the number of retail outlets, and to limit the nicotine in tobacco. And I want to thank Chloe, I want to thank the Greens for your support of that world-leading legislation. Now, I know that elections are about what we're going to do in the future, but I do want you to focus on smoke-free. The leading preventable cause of death is tobacco in New Zealand, and I want to stay in this role to be able to defend that legislation and to see all the regulations required to enact it through. I have absolutely no doubt, and you would have seen that reported on Radio New Zealand, that there will be efforts to subvert that legislation. And this requires a strong government that is committed to it from the beginning in order to fight steer those challenges down, and we will. An emerging challenge has been vaping, and you've seen that we've taken action to reduce the availability of vapes to young people recently. So that includes the stop on sales near schools and marae, the regulation of the types of flavours that are able to be offered, and a ban on certain batteries. That means that disposable vapes will be harder to sell. All of those are important controls. There is much more underway. There have been a number of things we've been able to do that have been in the too hard basket of public health for far too long. We took the politics out of fluoridation of water, giving the Director General the responsibility for making decisions on the fluoridation of local water supplies. We said that we mandated that bread must be folate fortified to prevent neural tube defects for babies growing in the womb that causes spina bifida. Many of these things have been tried over the last 15 years, but they haven't been able to achieve the political change to get there. I'm proud that we did. There's been a number of things in the area of communicable diseases where we have led, not just COVID. We've got an elimination strategy for HIV, and the number of new infections is halving in New Zealand. We have an elimination strategy for hepatitis C, and the new Māori Health Authority has grabbed that opportunity by the horns and is out promoting testing and treatment for hepatitis C, and we're doing that in more innovative settings. We're working with communities on rheumatic fever prevention, and we're dealing with many of the poor housing conditions through the Healthy Homes Initiative, which has been incredibly successful in evaluations by Otago University, reducing the hospital admissions of children in the household and increasing the chance that the parents are in work. We're fixing the public health infrastructure that had been allowed to languish for too long. I remember when I did my contact tracing report finding that some public health units were contact tracing COVID with an Excel sheet. How on earth could you do that? So we built a national contact tracing solution which has been redeployed for all communicable diseases starting with measles, and we used it successfully to stamp out 3 measles incursions this year. The national government promised to introduce human papillomavirus PCR screening. We have done the work to implement it. It'll be going live in September. And we've also rebuilt the National Immunisation Register off the back of the COVID immunisation register. All big investments, hard work, because we believe that public health interventions matter. We've rolled out bowel screening, which remained continuously as a pilot during the entire national government. We're doing the age extension, we're doing the fix of the register for breast screening as well. All big jobs in public health. And I know you'll ask about the social determinants of health. Our government has built more houses than any government since the 1950s now. Of course, there is still more work to do. We are very aware of the pressures in our community, but we're doing a good job tying that up. You would have seen that Waka Kotahi has new regulations on vehicle emissions that could markedly reduce respiratory illness in the community. We have taken action to fix the regulation of water, despite widespread opposition, because proper access to water is a human right. We are working hard across all of those areas. Now, I don't doubt there is more to do, and I'm unable to talk today about our full health portfolio, health manifesto, because that is yet to be released, but I desperately want to keep up the work that we're doing, perhaps with some new friends or some old friends in new positions, to keep up our progress and to defend the progress that we have made. And I want to make that point, that so much of the progress we have made is at risk. The alternative to our government at this election is one that will include a party that has promised, two parties that has promised tax cuts, and one of them incredibly harsh tax cuts. You cannot sustain the types of investments we are making in housing and the social determinants of health and the health system itself with those tax cuts. And secondly, a plank of the alternatives at this election, a core plank run by all of them, is an attack on the equity agenda that this government is incredibly proud of. It is absolutely important that if we are to improve the health of New Zealanders, we do so equitably. I'm incredibly proud to be from a party that has put utility at the heart of the health policy. I think the Māori Health Authority is doing a wonderful job in its first year of operations, and I'm proud to keep supporting it to do that job so that Māori have the opportunity to have greater determination over their health, and that we continue to be held to account by the Māori Health Authority for that work. So thank you very much for the contributions you have made to those achievements that I've outlined, in particular on tobacco control. I look forward to working with you in the years ahead.
Minister, well done for being Shane on time. That's pretty much exactly 10 minutes, I think.
Nā mi te rangi na mai te whenua, nā mi ki a koutou. Ki te kai karapia, tēnā koe. Thank you very much for the invitation to join you here today, and I acknowledge the organisers first of all, and I acknowledge mana whenua, and I acknowledge my parliamentary colleagues, Minister Chloe, and all of you as well. In this brief opening, I want to address our thinking across the four main survey topics, and I want to introduce a fifth that I think is missing. If you want to get a sense of our intention towards preventative care, look at our very first health policy announcement, because we've announced 3 policies, and everyone thinks it was all about bonding nurses. No, it wasn't. 1st of October last year, we actually made our first health policy announcement, and that's where we said we would increase the breast cancer screening age for New Zealand women from 70 to 74 years. I was sending a signal, having that as my first policy. I was sending 3 signals actually. The first was that preventative care will matter to me. The second was that cancer will matter to me. And the third was that women's health will matter to me. So that was actually my very first policy, 1st of October last year. Take the signals, that was my first policy, because I think they are good signals. I want to cover across some of the areas then. Cigarettes and nicotine reduction. Our position on the Smoke-Free Amendment Bill is well recorded. We mostly agree with the tools that were put on the table, but disagree with the implementation plan. More specifically, we would undertake de-nicotinisation first, because this is where most of the heavy lifting comes from. What the modelling showed was that 85% of the progress towards target would be done with de-nicotinisation, and we believe then that that should be the first kick-off initiative. Vaping. We are very supportive of legislation to further protect young people. We tabled 2 SOPs in my name, and the current government voted them down. The first was for new specialist vape store applications, that what must be taken into account is the proximity of other vaping stores. And this actually came from Local Government New Zealand, where it was pointed out that on the main street of Dargaville there are 3 specialist vaping stores within 100 metres of each other. Local Government New Zealand put it forward, we agreed with it and put it on the table during that bill, that the proximity of other specialist vape stores must be taken into account. That was voted down. We also had a second SOP in my name, and what that said is that we needed to be giving more authority, more support, more education to schools and community facilities to monitor underage vaping. That also was voted down. I think we actually need to be doing more. I'm interested in things like plain paper packaging for vaping. I do think one of the questions was, is there a position for more legislative change with vaping? I think the answer is yes. And an example I've given you is we are interested in things like plain paper packaging around vaping. And we have some other ideas there as well. Unhealthy foods. We are not in favour of removing GST on fruit and vegetables and agree that it is a boondoggle. Administering such a program is complex. There are concerns that pass-through of the GST may not necessarily occur, and if it does, the benefit has been estimated at $5.63 a week, or roughly $250 a year. We believe adjusting tax thresholds that will place an average of $1,000 a week into disposable spending creates more choices for New Zealanders. We want to increase choices. We understand the need for ka ora ka oko, but we also want to be doing more to help parents parent and provide regular meals to their families. We believe it is for local schools and communities to decide what is and what is not acceptable healthy food and drink practices. Public health infrastructure. We are supportive of policies that increase transparency, including timeliness as well as content. We are supportive of public sector employees being able to advocate for their regions. And the two examples of what we believe are bad behaviour in this respect are as follows. The first, and I think it was actually your bill, Chloe, Dr. Jackson at Middlemore Hospital sent out a recommendation to all MPs saying this bill would make a difference to my region, to my area. Well respected, he sent it to all MPs. I got it, my colleagues got it as well. A week later he was asked to retract it and apologise because he didn't have a mandate through Health New Zealand to speak on behalf of his local community. I think that is wrong. I think he had every position to advocate for his local community. The second example I'd give you is the smoking reduction arm of what was previously Northland DHB. As the Smoke Free Amendment Bill came through the Health Select Committee, the smoking reduction arm had made a number of, anticipating making a number of submissions. Now a number of good things have come out of Northland DHB in my view, and Northland, and the smoking reduction lobby. For example, second-hand smoking in vehicles. That came out of the Cancer Society Northland and school children, actually I think it was from Kamo as I recall, but I may have the school wrong, who then were able to bring that petition to Parliament and good things happened. However, they were told that as a region, as an area, they were not able to make a submission on behalf of that area, that it would go through Health New Zealand as their sanitised voice, and there would be one voice from Health New Zealand. I disagree with that. I think the Public Health Unit at Northland DHB should have been able to bring to the Select Committee their particular issues and concerns, and to have that sanitised and go through one voice in Health New Zealand, that doesn't work for me. I want to hear from the regions. You've seen one region, you've seen one region. Everyone's different, and I want to know all those differences so that we can synthesise all the information that's presented to us. What I think is missing from the survey is exercise. Where is exercise as a public health initiative? Outside of the health survey, the 3-yearly health survey, it's not clear to me that we have a regular inventory of levels of participation, fitness, health and sports activities, or clear goals and strategic objectives. Despite reflecting on this, I'm offering no specific policies here today. In fact, Boyd and I talked about 6 months ago, programs like Energise out of Waikato, whether that was deployable across the whole country, and we sort of didn't really reach a conclusion. But I think it's one part of the survey that did warrant some consideration. Commentary was made about our track record and what we've done and what we will do going forward. There are a number of public health initiatives that were put on the table, Campaign 2020, that have not been delivered. Where are the 20 mobile dental caravans? Campaign 2020 promised in that first year, missing in action. Where are the 4,000 Te Ara Oranga? Now, Te Ara Oranga, in my view, is the best methamphetamine program in New Zealand, with due respect to all the others who are doing good work also. I think Te Ara Oranga is excellent. As a combination of things. First of all, it's predicated on the Matrix program, which is probably the best style of methamphetamine reduction program across the world. It's got some of the lowest recidivist rates. It's a really excellent program. It's a light version of that. But secondly, it's a joint venture between police and health. And so you've got a breakdown of the silos. You've got these two agencies working together. And the promise was that it would be deployed across the country and there'd be 4,000 more consultation. Good idea. Good goal. Have they been achieved? Not even close. 100 at least. There's a new clinic at Urupara. Pleased to see that come up. but at best it may deliver between 100 to 200 new consultations a long stretch from the 4,000. I think that's an excellent program. That's the sort of program that has my support. It was the right goal to have, but it wasn't able to be reached. So as Mistress said, this is a contest of ideas. You can see what our thinking is, you'll hear what the other team's thinking are, and then make a view. What you see and what you hear, is it credible? Is there a track record that says we can probably deliver that? Do you get a sense of vision of, okay, I can see where the good ship health is going, where the direction of travel is. I understand that, I understand what the objectives are, what the milestones are, I understand this, and yes, I can do that. Because there's no doubt in my mind that we're going to need your support as well as the community's support to deliver any of the objectives that we're going to put on the table here today. We have a number of other things, some specifically to the survey, that are in our manifesto portfolio that I would deeply love to bring forward onto this podium today, but the timing of those sort of things is out of my hands, but I'm very much looking forward to sharing some of them with you. So again, thank you very much for the opportunity to be with you here today. Kia ora mai tātou.
Chloe Swarbrick.
Thanks, Corin. Just for the record, for future morning reports, it is Swarbrick. Swarbrick, thank you. Kia ora homa, thank you so much for having me. Thank you to the organisers for bringing us all together, and want to acknowledge my parliamentary colleagues as well. I just wanted to acknowledge the Minister, Dr. Ayesha Verrall in particular. We have had a lot of stuff to work on together over the past few years, and I know that I have been incredibly annoying on a few different points in particular, but we've managed to get some of those across the line, and particularly there I want to point out the disposable vapes. So you've all got that kind of matrix which points to all the specific policy responses that each of the parties has given. So I'll kind of, I think, actually just zoom out a little bit and speak to the macro approach that the Greens are taking on this stuff, but also just wanted to acknowledge I'm not actually our health spokesperson, that's Ricardo Menendez March. The reason that I'm here at this forum is because I have our mental health and drug law reform portfolios, and therefore oftentimes engage in the kind of public health responses and the broader kind of economic thinking about how it is that we can actually address some of these social determinants of harm, and particularly the manifestation of health issues. So I guess I'm also our revenue spokesperson, so that's another useful lever that we have at our disposal. But I guess to that effect, thinking about those kind of social determinants of both physical and mental ill health, it is really hard not to look at this stuff when you're looking at the kinds of issues that you guys are putting on the table with regard to tobacco and vaping, alcohol and unhealthy foods in particular. And this is why you'll hear a lot from the Greens this election, but also over the past few elections, with our very strong focus on ending poverty in this country. That is because we know that when you are talking about the notion of choice, when it comes to consumer choice, for example, and this is oftentimes used as the flag of individual responsibility with the likes of tobacco and vaping or unhealthy food and otherwise, what you're talking about when people do not have adequate incomes to be able to make those choices is the construction of choice. And that is where I so frequently see the power of these respective lobbies deciding to continue to create an environment that is not conducive to the well-being of all New Zealanders. So that's why we continue to hammer home that point about ending poverty, but also ensuring that everybody has access to a warm, dry, healthy home. And I want to acknowledge the work that the government has done with regard to the healthy home standards, but my critiques are pretty well on the record when it comes to the need to have a far greater enforcement mechanism with regard to the warrant of fitness. So then to alcohol and tobacco in particular, the Minister has spoken quite extensively about the work that's been done in this space, and of course the Greens were supportive of that. We are proud of the fact that in the Health Select Committee we managed to get a review clause in there, because there are still of course some levels of concern about the need to continually evaluate the evidential basis for some of these novel approaches inside of that legislation, particularly around denicotinization and otherwise. One of the really key things that we pushed for, and we're happy to get across the line, was through a kind of technical regulatory change, effectively getting rid of disposable vapes in our market. These are not only what appeal to young people, but also are cheaper, but they also tend to be, at least from what I hear anecdotally, the way that many people, younger people in particular, tend to convince themselves that they're not going to get addicted, start buying these, using them at parties, and then obviously go on to having that addiction. With regard to alcohol, you may be somewhat aware of the Alcohol Harm Minimisation Bill. I put this up about 2 years ago, and I want to acknowledge all of those from across the sector who worked really doggedly on this, because it was a huge campaign of over a year and a half. culminating in the Pass the Bill campaign and a petition handover of over 8,000 people. For those who are uninitiated in what the bill proposed, we said on the one hand that we wanted to get rid of the special appeals process in local alcohol policies. Really stoked that with all of the work and the spotlight that we put on this, that the government ended up adopting this in the community participation amendment legislation, which is currently passing through the House. But they did not decide to address that second part of the legislation, which was about removing the ability, per the 2014 Ministerial Forum, actually from the former national government, of sponsorship and marketing in sports of alcohol companies. And to that effect, I actually saw firsthand kind of the power and the insidious power of both the industry, but the power of the status quo. And I'll just give you some kind of example to that effect. When I first came out and said, let's address alcohol harm in this country, and particularly the kind of cultural influence that alcohol companies have, I thought that I'd be able to fight the alcohol lobby everywhere. I kind of invited them to fight them on the television and on the radio and on print in any format or platform that we possibly could. But I did not hear once, nor share a platform once with any of them. And I can't begin to tell you how they decided to operate, other than sometimes using proxies to speak in the public forum or otherwise. But we ended up seeing just how insidiously powerful the status quo was to that effect. And we have extensive research, not the least from that former report from Sir Graham Lowe, chaired by Sir Graham Lowe rather, which showed us that we're talking about just a drop in the bucket. It was approximately $21 million back in 2014. Sports NZ, the advertising industry, and the Sports Council could not tell me the value of it to this day, but they said that it had probably dropped in value, and therefore there are two levers that were available to the government. They could just fill the vacuum and provide some form of revenue replacement, or they could use the already existing alcohol levy. The solutions are there, and I don't know why we didn't just get on with it, so the pressure's not going to subside there. I guess again, just to point to that kind of approach that we take in public health with regard to substances, but it's pretty applicable across the board. Basically, when you're talking about the power of industry, when you're talking about this kind of construction of choice, when you're talking about these economies, you have kind of a spectrum of regulation that is available to you as public policy makers, right? At one end of the spectrum, you have complete prohibition of those products, and at the other end of the spectrum, you have a complete legal, relatively unregulated free market. At both ends of that spectrum, you have the extremes of harm, because you have entities, whether they are commercial organisations or criminal organisations, that are incentivised to shift as much of their product as is possible in order to make a quick buck. The way that you pull it back from those extremes is through sensible regulation, which tends to be ways to take profit out of the equation. And that's what you'll continue to hear from the Greens again and again and again. So if I can just leave with a few points that I would actually reflecting on from Dr. Shane Reti. When we're talking about exercise, and this is again to the kind of holistic approach that the Greens are taking, we need to stop focusing on building bloody roads. We need to focus, and this is the point around how we are designing our cities, and this is a particularly profound point to me as somebody from Tamaki Makaurau has just watched it sprawl and sprawl my entire lifetime. So we can do this stuff if we take that kind of holistic approach and we incentivise active modes. It's not only good for exercise and for health and community and connection, but it's also good for our environment and for the air quality and everything else, I think there's also a point to be made about the climate. And here I want to acknowledge Otago for the work that they have tirelessly done in submitting to a number of pieces of legislation before the House, because I think all of you are very profoundly aware of just how much climate change is going to exacerbate health inequities and health issues in this country. And I just finally wanted to shout out, I know there's many of you in this room who have contributed to all of these kaupapa, but Dr. Tim Chambers in particular for the mahi that you've done on both nitrates but also behind the scenes on this alcohol stuff. I'm really gutted that as far as most of our politicians were concerned of voting down the alcohol harm minimisation bill, that it fell on relatively deaf ears. But again, I think that the point needs to be made that this is the value of experts engaged in this discussion, particularly this public discussion. For the love of God, do not leave politics to the politicians, because we'll get what we've always got. We need you and we need your voices in this election, but don't think that politics just happens every 3 years with a general election. As I've alluded to, with the power of the industry constantly lobbying using proxies and otherwise, you need to be involved every single day that you possibly can and using your voice, because you can change everything. Thank you.
But it says, Dr. Reti, which Māori have you consulted with to develop your health policy? Will National dismantle te akai whai ora, and why would you do that?
Kia ora mai. Yes, thank you. Yes, we will establish the Māori Health Authority, and we'll do that because I do not believe that centralising authority and decision-making to Wellington and telling what the people on the North Hokianga is best for them is right and correct. You cannot possibly look out your Wellington window and say, oh, Panguru Mitimiti, I know what's good for you. How can that be possible? How does that work? So yes, we'll disestablish the Māori Health Authority. We have spoke with many iwi leaders and continue to do so. We've developed an alternative model that will devolve more authority, more commissioning authority, more responsibility to the regions, closer to the home and closer to the hapu is the narrative that I use, than Pai Ora allows. So yes, I understand Māori Health Inequity is published on it, I get that, and don't disagree in one little bit. But I do disagree that centralising that authority under a Māori Health Authority to Wellington is not the correct model, and we will have a different approach. Yes.
Kia ora. Right, the next question is a big issue, and I think I'll get all of you to comment on this. Perhaps if I could start with Dr. Verrall. Alcohol causes significant harm, including contributing to 7 types of cancer. What plans do you have to address this, and when?
Thank you. I acknowledge the many harms caused by alcohol. I think that makes a justification for greater regulation and control of those harms. I'm not able to announce what our health policy is today, but I want to congratulate Chloe on the work that was done on the bill that the government has adopted. Many of those proposals in the government's own bill, I think, would look for opportunities to continue in that vein.
Can I just push you a little bit further on that? Are you looking, you have committed to do more work, right, in this area in relation to Chloe's bill. Are you looking at the levy on alcohol and whether you could come up with a smoke-free type replacement for advertising and sponsorship? Is there investigation at the very least?
Yeah, I hope you understand I'm not able to go into our manifesto today, but actually every health minister has to look at the levy every year. You're required to take a decision on it every year, and you're required to make that decision in light of health promotion opportunities.
So it's being investigated?
Well, it has to be looked at, so yes, every minister looks at it.
And the smoke-free type of model?
I think it's been a successful model with smoke-free.
Okay. Chloe, do you want to pick up on that perhaps? Where do you see things being able to go further? You obviously met a level of resistance, and then...
And we keep going.
And you'll keep going. What would be the top priority on alcohol?
Yeah, so based on the World Health Organization kind of best buys in the space of unhealthy foods and alcohol, and I think also tobacco, it's pricing, availability and access, if I'm not incorrect. So what my bill was focused on was primarily around kind of the availability with regard to LAP's part, but also around kind of the social norming of alcohol. So this is also a profoundly challenging mental ill health issue, and want to acknowledge Rose Crossan, who's done some phenomenal research on some of the really devastating statistics with regard to alcohol's association to suicide in this country. And again, there's many in this room who I'm sure have also been involved in many pieces of research and evidence gathering about just how bad this issue is. And this is where I guess I just get really, really frustrated with some of the bad faith arguments that we hear in the chamber, and I'd really love to hear from Dr. Shane Reti on this in particular, because when I put forward the bill based on those really, what I thought were lowest hanging fruit propositions from the 2014 Ministerial Forum, focused solely, aside from the LAP special appeal stuff, on product-only advertising and broadcast sports. The resistance that I was met with was firstly that, why isn't this extending to arts and cultural programs? And I was like, cool, let's extend it to arts and cultural programs though. They didn't want to do that. And then the next thing was, well, how are we going to fill the gap? And again, as I put forward in my introductory remarks there are 2 key ways that the government could do that. They could just fill the gap themselves through approximately $21 million per annum, or they could use the alcohol levy, which already exists. So there is no meaningful evidential argument against this happening beyond just the status quo inertia. So I guess where the Greens would want to see things going is that we should see that review. I am a little bit concerned about the efficacy of what are called sin taxes, because you can push taxes beyond a point where they are effective and then can generate black markets and otherwise. So I think there's a valid discussion and debate to be had there. With regard to availability, I'm really hopeful that the changes to the LAP process under the community participation ledge for the government, which obviously adopted part of my bill, will help to kind of quash the proliferation of outlets, particularly in lower income communities. But I think that outright, at the end of the day, we just have to end alcohol advertising and sponsorship in this country, completely and totally.
Okay, Dr. Reti, maybe I'll pick up on that point. What is National's position on sponsorship advertising for alcohol? Would you consider any crackdown on that?
Sure. So our Justice spokesman person covered these arguments in the House, as did the government of the day, who also voted against the bill. And we did have issues around the appeals process. We had issues of the relationship to sport particularly. All of these were well covered in the House, and as I say, we actually joined with the government of the day to vote against that. Look, we actually think that education remains the key initiative for reducing harm from alcohol. We haven't been considering levy changes, but nor do we have a bevy of officials behind us to help us with impact analysis. So that doesn't mean that it's a not, it's just that we don't have those tools, and it doesn't sit actively on our table at the moment. It's not our current policy, but you'll see support from us around education.
You recently went out across the country with ambulances.
A lot, is the answer to your question. A lot.
Yes, you did.
Yeah.
Did you see firsthand the harm of alcohol?
A lot, yes.
And what is your thinking around the need to do more than, more regulations, more restrictions?
Yeah, I get information from my local area around some of the local harms every week, and have communicated to local officials, wow, look how much each of these events you're identifying to me are alcohol related. So I get it and I see it, and I absolutely agree we need to be doing more. Our view is that it probably needs to be through education mechanisms.
What would that educate? What is that?
So that would involve some of the NGOs that are already very strong in this space. How do we do more of that? How do we do more in the schools? How do we help what you're doing, or how do we do new things? And we're prepared to fund that as well.
All right, I'm going to go back to smoking now, which is kind of the top of the list here, and the smoke-free 2025 legislation. And perhaps I'll just start and we'll go back the other way with Dr. Reti. Firstly, you talked about in your opening gambit about going with taking the nicotine levels down first. Are you committed to the time frames in the legislation in terms of the outlets, the process, the 2009, those born after that, all those key points that make this world-leading legislation? Are you committed to them?
Oh, we did even more than that. We put an SOP on the table in my name that set out timeframes, and we said that we de-nicotinise for 2 years and then review, and if we've achieved our target, which the modelling mostly suggests we will, if we achieve the target of the de-nicotisation, then we'll review them. So those timeframes are all set out in my SOP. Each subsequent tool depends on whether we've achieved the goal or not.
But do you support in principle the idea of what is it, if basically meaning that anyone born after 2009 can't buy cigarettes?
Oh, the smoke-free generation.
Yes.
Again, let's bring out all the tools, see if we've reached the target or not, and whether the target is still valid, and then see whether we need to deploy further tools.
Okay, Chloe, do you see, is that it for smoking legislation? Has the work been done, 30 years of work, is that as far as you can go?
No, I think that there's definitely always going to be more work that can be done, and that was part of the point around the review being put into the legislation per the Health Select Committee recommendations, which I was involved in. And I'd say as well that no public policy area should ever be considered as done and dusted, and it is going to constantly require review and upgrades based on the best available evidence to us.
Do you worry? You did mention, just quickly on that, you did mention the worries about black markets and these sorts of things, obviously tobacco. Are you worried about that? Obviously it's been an issue with tobacco.
Yeah, this was on the record well canvassed from me throughout if anyone wants to go on the hand side, but also actually during budget night 1 or 2 years ago, around particularly the amount of spending that's occurring at customs for stopping black market tobacco coming in across the border. And again, this is the point of kind of constant review to make sure that we've got the settings right. But that's not to say that we should ever operate in the space of absolutes, which I do worry about in the way that our politics tends to be quite black and white. Either this thing is on the table or it's not. There are ways for us to improve in a nuanced and sophisticated way and respond to that evidence.
Dr. Verrall, is that it for smoke-free legislation?
No, there's always work to do, and clearly these are bold proposals that we're implementing through the smoke-free legislation, and responsible legislators will keep them under review. As I said earlier, this is the leading cause of preventable death in New Zealand, and we have passed world-leading legislation. Now, in that answer from the National Party spokesperson, you didn't hear a commitment to keep the measures in the bill in place. You didn't hear a commitment to keep the smoke-free generation. I think he could clarify his position better.
Dr. Reti, do you want to take that opportunity?
Yeah, sure. Look, my yes, very clear, the one you voted down, actually. Look at that, and all the time frames are there. If we've achieved the goal with denicotization, why would we want to do more? And so we need to roll it out, see if the modelling actually stands up, and see if it's got substance or not. And if it does, then well and good. It's already been achieved, the target's been good. And if not, but you voted it down, your team voted it down, so those time frames are very clear.
Vaping too, so let's just deal with that quickly. Do you see much more tougher restrictions, further restrictions on vaping?
Yes, we just can't be happy with where underage vaping, particularly school-age vaping, is at the moment. And I was on that select committee with you, Chloe, I think, as vaping came along in the last parliament, and we were always worried that it was going to be a gateway. We were trying to get that balance of stopping adult smoking reduction, which I think vaping has. I think we should be pleased with that. And then concerned about, but how do we not make it a gateway for school children? And it looks like that hasn't been as effective as it would. And so, as I've said to you, we have plans around vaping, the ones we already have in SOPs. And we're also looking, as I mentioned, at things like plain paper packaging and other marketing components to vaping that we probably need to address.
Just let's pass that along. Do we see a situation where we become vape-free? This is a question that's covered.
Yeah, I mean, I think even within smoke-free, it's 5% or less of the population, just in terms of how we define what smoke-free is, 5% or less of the population. So, I mean, I think this is the reality of when we're talking about any given substance, right? When we're talking about particularly substances that can be addictive, we can say that substance can be harmful. How do we best create a regulatory model to reduce that harm? I'm very conscious here of the harms that come with criminal prohibition, particularly in dragging people through the criminal justice system, and this was something that I actively worked and engaged with the Minister on when it was around the smoke-free generation piece. So I think that, ultimately, yes, we should be aiming absolutely to reduce the number of people who are vaping, especially those who are not using it as a cessation device, but it's just picking it up, especially our young people. And to that effect, I don't think that anyone can say that we've got the policy settings right, but there have been huge moves, particularly in the testing of products, and also with regard to the removal of certain product names, and also I think that the disposable vapes regs will have a meaningful impact. And that's the point around constantly evaluating and updating our public policy response. The final thing that I would say, though, is that most people who I talk to out there in the public aren't aware that we didn't have any form of meaningful regulation on vaping until 2019. And it was effectively self-regulated by the industry, which is where we saw the proliferation of kind of cultural norming. We saw influencer marketing, YouTube ads. My 15-year-old brother was asking for a vape for Christmas. You know, this was the kind of stuff that we saw just out there, and we finally started to rein it in, but a bit too late, and we're now dealing with the consequences of that. So I think we have to be honest about where we're starting and the fact that it is going to take time for us to put in place meaningful public policy responses. But we also have to be cautious not to engage in kind of knee-jerk political responses that have massive perverse consequences, for example, the proliferation of the black market.
Dr. Verrall, do you accept that criticism that the government is too slow?
I'm still on tobacco, but I will come to vaping. I don't agree with the National Party spokesperson on this issue to do with tobacco control. This is a fig leaf to argue about individual bits and their timing in the legislation. There is a very clear way to get tobacco out of our community, and it's leading preventable cause of death. And I think the only responsible stance is to keep the bill as it is. With respect to vaping, we're in a very challenging situation. We're in a Chloe's right that there was no regulation until 5 years ago. That brought in vape-free schools. It brought in under a requirement not to sell to under 18s, which is still the law. Since then, we have added the requirements that are coming in to make sure that vapes, there's a reduction in the number of flavours that they can be marketed on, which is a similar principle to plain packaging. The changes in the batteries that address disposable vapes, and the specialist vape stores being near, new specialist vape stores being near schools. It is an incredibly challenging area where trends emerge so rapidly. You look at the vaping rates essentially over the course of the pandemic, and they went in some youth from less than 5% to between 10 and 15%. A really marked rapid change. And yet we have to regulate, and that does take time, and we have to do regulation deliberately, because I can tell you every step we have taken has been legally challenged. So that is frustrating when we see a problem that we want to fix, but it is the obligation of regulators to step through that in a way that can be justified, so that we are not ankle-tapped by the industry when we try and put our steps into place. In terms of Labour Party policy, we've got these new measures being coming in shortly, and then in the next term of government, my view is that we will continue to look at all options, regulatory and legislative, if we cannot get the problem under control.
Okay, let's move on to some of the issues around food, because there's a few interesting questions coming in here, and I'll read this question out. You can feel free to accept it or not and answer it. Perhaps we'll start with you with the mic there. Exercise has been shown to be ineffective, says this questioner. Intervention for obesity without additional intervention to increase access to healthy food. How will this be done? Do you accept that exercise has been proven to be effective?
Clearly not on a personal level, because I was doggedly out on Oriental Parade trying otherwise this morning. I think exercise has to be part of the solutions, but I think what the questioner is getting at is that there is an important role for promoting access to healthy food, and I agree. We make the healthiest food in the world in Aotearoa, and yet the economies of our food supply means that it's outside the reach of many of our people. It is part of, this is a long-standing issue, but has been exacerbated by the cost of living crisis, and numerous measures by the government to try and make sure those on low or middle incomes have enough money to be able to afford healthy food, and in addition to that, directly making sure that school lunches are provided in some of the lower decile schools to make sure that those are available. There is more control over healthy food being available to people. It is absolutely an area where I want to see further work done, and that's why the Public Health Advisory Committee, which is a committee you might not have heard about, set up under the Pylora legislation. I've asked them, it's chaired by Kevin Haig, I've asked them to do a piece of work about healthy food environments as well, so we can see how our communities can get back control of the food that they're able to access.
Many moons ago, I remember Labour on a campaign that I was covering was pushing for the idea of regulating sugar within baked beans or whatever food, cutting the sugar limits, sugar taxes, sugar restrictions. Are they just a no-go now?
Yeah, I think the issue, the challenge around regulating food composition, I learned during my stint as Food Safety Minister, is that food composition is regulated through the joint food system, part of under a bilateral treaty with Australia. And the challenge there is that regulation needs to be agreed between New Zealand and the states of Australia. It is very challenging. We do have to, however, FSANZ has, which is the regulatory organisation, has shown a greater interest in these types of food composition and public health regulation, and the government continues to advocate for more public health considerations in that area.
Chloe, would you, if you were in government with Labour, push them into those sorts of policies a bit harder, sugar taxes, those sort of things? Is that something on your agenda?
The investigation of them is part of our party policy as created by our members, so absolutely we should not be taking levers off the table which are proven internationally to have efficacy. But again, with regard to kind of our international agreements and other ways, I think, again, we need to grapple with that complexity, so I don't think that anyone would be well served by us making kind of policy promises off the cuff. To respond to the other part around access to healthy food, this is again where I think it's really important for us to kind of contextualise this within the broader consideration of what we think of as the economy and the way that we obviously are regulating things like, for example, our supermarkets. And that's why the Greens have been supportive of, but want to see the government go further and faster on some of the pieces from the Commerce Commission inquiry into the supermarket duopoly. I'd also say that we'd like to see school lunches expanded universally because with regard to the return on investment and the ability for us to fund them properly, we can have a fairer tax system, guys. The David Parker commissioned the research, found that the top 311 families in this country are paying an effective tax rate less than half of that of the average New Zealander. But we also can continue to support localised actions that are already occurring on the ground. And here I can speak to some of the experiences that I've had in Tamaki Makaurau with regard to expansion of Marakai around some of our more urban marae, but also for greater proliferation of urban farms, for example, which also has that co-benefit of an educational kind of component so that people have a greater understanding of where their food actually comes from and obviously reduced embodied carbon from the travelling of that food too. And then people eat seasonally, which we also know is more beneficial.
Dr. Reti, coming back to that original question around the benefits of exercise versus healthy food, where is National on the issue of trying to promote and get people eating more healthy food?
So look, I don't substantively disagree with what the Minister was saying, and of course exercise needs to be part of a weight reduction program. What I want to just point to for a moment though is it's not clear to me that the star rating on food is still a system that's fit for purpose. I'm just not sure that it's providing the information for people to make informed decisions that we hoped it would. And I wonder if it is past its use by date itself and whether it needs to be modernised and relooked at. It's a body of work that's going to need more officials than I have at my hands. And its intent was good when it was first brought out. But I just think it needs further looking at, actually. I think at how we transfer that information to New Zealand so they can make decisions. Just not clear that it's doing
So the response is about personal responsibility and the people
the transfer of information so that we can transfer information so that people can easily make choices on food packaging, I think is important.
Can't do it if you're poor.
Yeah, change the tax thresholds.
Okay, I'll come back through on the issue of food, the schools program, the lunches program, and let's go back this way, but nationally, have you committed to keeping that policy?
Yeah, I spoke about that in my opening remarks and said that we understand the need for those programs, and it is our policy to keep them. But what we also want to do is try and help parents to parent in whatever their hurdles are so that they're able to better provide that sort of requirement, that sort of food and nutrition that children.
Will it be more targeted? I mean, is it going to be the same size?
At this point, what the offering is what we would maintain, and then we'd assess whether we needed to expand it, how we could wrap around it, so we wouldn't be reducing it at this point.
Okay, let's keep going on the food issue. Junk food marketing, this questioner says to kids, is self-regulated by the industry. How is this approach in the best interest of our kids? Perhaps, Chloe, you want to pick up on that?
Yeah, so currently, as I understand it is a voluntary code under the Advertising Standards Authority. So the Greens' position is that we would make the Children and Young People's Code mandatory and tighten regulation on unhealthy food advertising as part of the 5-yearly review. It's pretty crystal clear. We don't want that to be a voluntary code. We want it to be mandatory, and we want to restrict marketing to our young people.
Minister, would you look to implement any further restrictions, regulations around junk food marketing, particularly towards kids?
I'm unable to go into what the context of the party manifesto is today, but I understand the points about marketing products to young people, including alcohol marketing, has been discussed earlier.
Let me put it another way. Are you worried about what you're seeing in terms of junk food advertising, marketing aimed at kids?
I think I am aware of the evidence which shows that children are exposed to a high level of junk food marketing.
There's another specific question that's coming on this, a couple of them around school canteens and junk food sold there, and I'm not quite sure where we ended up on that in terms of the policy, but perhaps if each of you could just give us a view on whether or not there needs to be any more restrictions and controls around canteens sales.
Yeah, look, I think that is part. Canteens at school is part of where we can set norms about what healthy behaviour and food and drink is, and I'm interested in opportunities to do that, but unfortunately I'm able to say what our commitment is in that space today.
Yeah, I'd say sure, with the investigation, especially with the Ministry of Education's involvement, but I'd also say that definitely, based on my experience in talking to school principals and teachers and also school kids, is that there is a primary issue in that we're not only just talking about the potential of restricting access to unhealthy foods, but also the access to healthy foods in the first place. So I think that that's perhaps the primary issue that we have to address, ensuring that there are those healthy foods that are available as an option in the first place, because again, otherwise we're talking about the construction of choice by saying people have to go further kind of outside of those canteens, spend more money in order to get access to those ostensible options.
We think those are local decisions for parents, schools and boards of trustees, so we want them to make those decisions.
Do you have any, does National looking at any issues around what Chloe was saying here, the actual provision or ways to help provide more healthy food options, rather than a regulatory response?
Look, I can't say that we've done a great deal of work on that, to be frank, but nor am I saying that we'd strike it out. That would be an honest answer. And
just quickly, because some of the questions come to the top here around health costs, and there was one question, just a sugar tax, that's not something we would consider?
No, but we continue to look offshore. I said a few years ago that I was very interested in the UK sugar tax, that I think it was 8 milligrams and 4 milligrams is the cut-off point, and some of the evidence from that. I think some of the data, and you can't wait forever saying, well, when we get the evidence, it's actually been deployed for a while. So there are some interesting parts. It's not part of our policy, but we'll keep looking at.
So, sorry, just to expand on that a little bit, what do you say?
Oh, the British sugar tax, if you want to call it that. That was kind of interesting. Everyone was saying, the soda industry, for example, was going to collapse. No, it didn't. And it generated more revenue than they ever expected. That wasn't its prime purpose. And so there are some parts of what the international models are doing that are worth taking note of and considering whether there's a position. It is not our position today, but we will keep looking.
Okay, let's move on to some healthcare costs. This one's a big question from Lisa. It says, healthcare costs will continue to rise given the major role on health, diet and smoking and disease. How much of the health budget should go into prevention? Dr. Reti, if you want to start with that. I mean, should there be an increase in the money going into prevention?
Look, that's kind of hard to answer. I mean, we all want to say yes, but if you want to quantify that, that's kind of challenging. In fact, I posed this as a ministerial question about 3 weeks ago in anticipation of coming to this forum, and the reply was, that's hard to assess, which I think is probably a fair answer. So I can't give you a figure on that, other than our shared interest, I'm sure, in doing more in promotion, but that's a little bit wishy-washy.
As a GP, as a doctor, do you think it's too low? Have we got the focus wrong over recent years?
I think that belief that prevention will reduce pressure on all our key pressure points at the moment, be it primary care, be it ED, wait lists, pretty much you want to name it, that public health and prevention is the way to reduce them. Yes, that's a principle I believe in, and if that requires more funding to achieve those goals, then yes, that's what it requires. It's a long game, prevention, and you need to be brave enough to put a stake in the sand now and see benefits 5, 10 and 15 years. If we do something here today in this room, we won't see a benefit on Wellington ED tonight. That's not going to happen. So you need that sort of vision and courage to go all that way out and say, but I do believe there'll be benefits further out.
Yeah, of course we should be investing more in prevention, but I think the bigger political question is what do we actually conceive of or define as prevention? Because I guess just to give you a level of insight into the cross-party group on mental health and addiction wellbeing, which I was involved in forming with Louisa Wall and Matt Ducey in the last term of Parliament. To lift the lid on that, it's been very free and frank, and I have done this on other platforms, so I'm not giving anything away here. We discuss ad nauseum the kinds of areas that we could potentially find public policy agreement on, and we can agree that we want to see kind of zero suicide in this country. We want to see greater education for young people when it comes to awareness of mental ill health and how to support each other. But we cannot, for the life of me, get agreement on the social determinants of mental ill health, despite the overwhelming avalanche of evidence that tells us all of that stuff. So, again, I go back to that point about how politicians in general and in the main are totally unwilling to address the poverty question, the housing question, and those core determinants of people's mental and physical well-being, and that is the primary fence at the top of the cliff. So, yeah, that's actually just where I get really angry about this conversation about prevention, is that we're unwilling to talk about the inherent dignity of people and ensuring that everybody has what they need to live a good life, let alone to make these apparent decisions.
The principle that prevention is better than cure underpins all of my work in the health portfolio, and it's why I'm so determined to see through the smoke-free work, which, as well as addressing the leading preventable cause of death, saves billions in healthcare costs. And while those costs, Tony Blakely's model put it out to 20 years, you actually start to see them after 5 years. And maybe we're starting to see some of the recent progress we've made with tobacco control impact lung cancer rates already. So you have to start, is the answer. There's no point saying, well, it'll take forever, so we're not going to start. We're making progress with tobacco control, but across the range, funding in increased HIV treatments, driving down HIV transmission is really important, funding of vaccinations. The question was whether we see a role for increasing the amount of funding put towards prevention. I broaden that slightly and say, yes, absolutely, prevention and community care, including primary care, we will increase. And we've developed the tools to do that through the health reforms. We've tidied up the number of appropriations in health so that you can see this. We've only got about 6 major appropriations in health now. And so you can see what's going into primary and community care. And we can gradually start to shift the dial on how that investment is allocated relative to the hospitals over time. We still have tremendous pressures in our hospital system to manage as well. In terms of prevention, I think it's not just the big ticket items like smoking. The copay, getting rid of the copays on medicines, incredibly important thing, from preventing chronic disease from becoming major medical events like strokes, hospital admissions and heart attacks. The other area we don't talk about prevention enough, I've always mentioned mental health. That's been an important area of focus, but another one is prevention and the care of the elderly. That is an incredibly important area to make sure people are kept strong and independent and well in their homes. So those are areas where I see our work with primary care system and also communities through localities in the coming 3 years will be a really important way of turning around people's health.
Let's catch up on a few questions that have come through from the floor. This one from Rachel Thomas to Dr. Reti on alcohol. Do you truly believe education works for people and whānau in the cycle of addiction?
Yes, I do. I believe we need to be doing more. I believe we need to have more NGOs and they need to be given more tools. But yes, of course I believe education is a critical part to it.
Give us some examples of how that would work.
Various trusts that go out to the schools and teach responsible drinking and teach the harms. I think that's really effective. Whānau providers as well, by the way. I think that's effective. I think it can be made more effective. I think they need to be given more tools and need more of them.
What do you mean by responsible drinking?
Responsible drinking that expresses that here's a quantity of drinking in a forum, in a format that is safe for you physically, that is safe for you socially. That is what safe drinking looks like. Have you been a safe drinker? How can we help you? What are your triggers? What changes the environment? How do we provide safe environments for you? If you find yourself in a position where you haven't been a safe drinker, how can we remediate that? Those are all parts of
What would you say, before I move on, and some people would argue there's no safe drinking?
Or the evidence would say.
If you look, I understand that, but it's also not a pragmatic reality. And so we need to deal with what the situation is rather than have hopefuls and say, if this is the situation, then how can we make it as safe as possible for everyone? That's what we need to do.
Chloe?
I wish that we would take that pragmatic reality approach to, I don't know, cannabis. The Greens, I think, are the only party that you'll find consistently in our parliament, whether it is cannabis, alcohol, tobacco, or other substances, taking the exact same evidence-based approach, which is that you can have a substance and know that that substance can potentially cause harm. So how do we then deal with the question of regulation to reduce that harm? And if we had, for example, alcohol regulation, which was, I don't know, copy and pasted from the Cannabis Legalisation and Control Bill, we would have had restriction on the number of liquor outlets, we would have had greater imposition with regard to duty of care for those who are selling and supplying, we would have had limitations on the amount that people can purchase, and we would have had complete prohibition on advertising and sponsorship. That's what logical consistency looks like, and that's what living in pragmatic reality looks like as far as I'm concerned.
Yeah. In some ways, Labor is in a similar situation to National in that it has to accept the political realities around this, doesn't it? I mean, do you personally believe that any alcohol is not harmful?
Yes, I believe in my public health utopia, alcohol would have a place. It would have a place, but it would be, we wouldn't see the level of hazardous drinking that we currently have. And in that sense, I think it is different from tobacco, which I believe has a very limited or no place in a healthy society.
In terms of the political realities, the Parliament doesn't have a great track record of dealing with alcohol, does it? I mean, does Labor have any commitment to pushing further in this area, or is it too hard basket?
As I said, I'm interested in continuing the work, and we'll be able to be more specific when we put out our manifesto and we see alcohol regulation, alcohol harm as it is a health issue that we need to make more progress on.
Okay, let me take a slight tangent on this because there's a good question that's come in, which says, what will you do to restrict harmful commodity industries like the alcohol industry from engaging in health policy making, like we saw with tobacco? So you talked about this being fought all the way on vaping and things like that. In terms of the role of alcohol in policy making in those sorts of industries, what do you think needs to change? Does anything need to change?
I think two things. I think what I understood, Corin, when you said political reality, was the reality of everyday people out there is not the view, that they don't have the view that alcohol, that I would say there's not a high level of consensus in the community around alcohol regulation. That's point one. Two, about lobbying. I think it is important that we do more to address the role of lobbying in our community. To be honest, I don't, and you'll know from my ministerial releases of my diary, I don't have any direct approaches to me made by the tobacco industry. They go around the back and they astroturf community groups that then try raise those concerns through other settings, and that was the most recent campaign was identified by Radio New Zealand recently. However, on the issue of lobbyists, yes, we do want to see more done to stop undue influence in that way. So Prime Minister Hipkins has already said that lobbyists shouldn't be allowed swipe card entry to the beehive. Secondly, there's been an amendment to the Cabinet Manual to address ministerial people working in ministerial offices, working in a way which is to get opportunities in the lobbying industry, and he has requested that the industry develop a code of conduct in the lobbying industry for the future. He has also asked for a further piece of work to be done around what our other options are, as well as those three initial measures.
Chloe, does the alcohol industry have every right to lobby its case?
I mean, if they had the same resources as all the community organisations who are lobbying their case, the fact is it's a David and Goliath situation. And if you look at how the scrum's been screwed by structurally enabling kind of the normalisation, glamorisation of alcohol products, and therefore kind of the status quo norm of the place of alcohol within our society, and just I think about how that kind of was extrapolated into the space where my bill, the Alcohol Harm decarbonisation bill, which was focused primarily on two key, what I thought were low-hanging fruit interventions, which again have mountains of evidence behind them in terms of special appeals for LAPs and the removal of product-only advertising and broadcast sports. The way that those interventions were conflated as somehow being about criminal prohibition of alcohol was insane. And I think that that shows you the kind of norm of the power of the industry and the way that kind of any form of change in that space is conflated as taking away alcohol from people, as opposed to just kind of changing the landscape for lobbying or the political power otherwise.
Dr. Reti, on the issue of lobbying, do you see any issue there?
Yeah, so this was one of the public infrastructure questions on the survey, and I agree that greater transparency is a good thing with lobbying, and it shapes behaviour. If they know that their actions are visible, those actions are likely to change. So I do support greater transparency with lobbying.
What about legislation that would say prevent, this is a question that's come in, the issue, regulate lobbying, revolving doors, which we've seen issues with. Would you consider any legislation along those lines?
We wouldn't go any further than what's been done at the moment. We are supportive of the steps that have been made, but we don't have this policy to progress any further at this point.
There was another issue I think you alluded to in your opening remarks, which is around public officials being able to speak out publicly, or something I know that Health Coalition has mentioned as well. Does there need to be greater protection for public health officials in the public sector to be able to express their views publicly without getting into trouble?
I think when there are collectives of public health officials like those in the public health units, I think we should listen to the regional voice of those, what were those 12 public health units, those PHUs. I think they should be able to express their voice, bring it to select committee, tell us what we otherwise wouldn't know so we can make better policy. So yes, I do want to hear more from them.
Would you formalise that in any way? If you
yes, I would, and make a policy statement. Reverse the current position that all PHU advice to select committee has to go through Health New Zealand and be sanitised. I would reverse that.
I want to go to Dr. Verrall on that if I can, because that criticism is directed, I guess, at your ministry or Te Whatuora, that it is too overbearing, too controlling, people can't speak out on public health issues.
Yeah, an issue of concern to me too, and I think there has been work within Te Whatuora to change their position recently, so I can summarise what that is. Firstly, there is a way forward for addressing some of these core issues of public health within Te Whatuora. They form networks around food, around alcohol, other public health threats, and are working on policy and public health priorities within that. And there is a pathway for being able to make statements on those issues for our public health professionals on behalf of Te Whatuora. Now, when there are individuals who feel that their voice is not captured by that, there is another way, which is that they are able, and it's often reflected in contracts, for example, the employment contract of those people. For example, many medical officers would be on the ASMIS contract. They are able, as an individual, to speak out on health issues, and as an individual could go to a select committee and say, my experience as a public health physician is this, but you couldn't claim to represent Te Whatuora if you did it that way. I do want to say that it is important that we don't get confused here, because there is a very important principle that our public health officials are working levers of government. They are in many ways public servants, and they do have to have regard to how their independence is perceived. It's a very important principle. It stops undue politicisation of important parts of our public health infrastructure. We think the process that has been brought through is a way of achieving that balance.
How would you want to respond to that?
Yeah, I mean, I've raised these concerns with the Minister directly, and I haven't quite been able to drill down into what the specific kind of barriers are, and the Minister's alluded to potentially being cultural or structural. It's still not quite clear, so there is, I think, still more work to do. But as Dr. Reti alluded to in his earlier remarks around my alcohol bill, which was kind of occurring concurrently with the Te Whatuora change, what I saw very clearly was the switch between kind of public health officials who had previously under the DHB model and the HPA had the ability to speak out about these kinds of things and offer their comment in public forum, to then all of a sudden being stymied in doing so. Whether that was kind of concern about what might occur under the new structural model, who knows? But yeah, I do hold ongoing concerns in that space, and to that effect I also have concerns around how whatever kind of format the new HPA takes, and given the vulnerability of all of this stuff, given political cycles, what that might mean for other organisations who are receiving funding in the space of public health promotion for their funding.
This question for Dr. Reti, it says, I know you care about equity. How will National's proposed tax reforms, which put more money in the pockets of wealthy, advance Māori health equity?
What we know is that the proposed tax thresholds will put roughly $1,000 a year into people's pockets so that they get more of their own money back to make choices, as we've said, food choices and other choices that they want to make. We would understand equity, and a range of equity, by the way. We could talk about access equity, we were talking about health, about access equity, we could talk about a range of equity. We think the levers to equity are several-fold. First of all, cultural competency. We think if we do a better job with cultural competency right from the beginning of a health practitioner's journey, right through medical schools, right through their colleges, right through the organisations they land, that will address some of the particular subconscious bias, that will do a better job addressing that. And then we also think the social determinants of health have equity issues, be it income, employment, education, housing, all those really big social determinants of health. They have equity issues as well that we're very interested in addressing.
Just to be clear, that you're saying you do accept that there is a cultural disadvantage and that a Māori Pacific person going to the doctor may experience a disadvantage simply because of their cultural background?
Yes, I do, and that is why I think cultural competency is so absolutely critical. And this is not to diminish some of the work that's already been done. Some of the PHOs and some of the organisations have online training and various forms of training. I've got to do a certain number of units each year for my annual practicing certificate, but I think we need to do more. I think we need to step that up.
Do all your colleagues accept that?
Yes.
Okay. I want to do one last question to all of you, because we've got about 3 or 4 minutes to go, and perhaps if we start, maybe we'll start. We'll work our way up. Last question, what is the biggest barrier to achieving health in Aotearoa, and how will you eliminate it, the barrier that is?
The biggest barrier to health in Aotearoa is lack of embodiment of Te Tiriti of Waitangi in our health system. And you just look at the facts. You look at the fact that life expectancy is different between Māori and Pākehā, and there is your answer. What other answer can there be to this question, particularly if you oppose tobacco control? So that's why what we have done with the Māori Health Authority is so important. It is why having Māori at every conversation about health matters. It is not fair to characterise the Māori Health Authority and the Paiora reforms that embed Te Tiriti in our health system as centralisation. There are iwi Māori partnership boards as part of that architecture as well that are also being set up. This change is already having an impact, and the impact that Te Aka Whaiora ran to the cyclones, and the fact that Te Aka Whaiora had a voice in the therapeutic products bill that led to greater recognition of rongoa in that piece of legislation. It is absolutely critical if we improve health, if we are to improve health in New Zealand, that we address this. And then that will bring to the fore many of the things that we've discussed today. It will bring to the fore issues around housing. It will bring to the fore issues, the tobacco control has actually been led by Māori in large part in our political discourse in New Zealand. So I see that as the overarching issue that unlocks so much about poor health in New Zealand, and that is why I'm so determined to keep fighting for the Māori Health Authority and to reject the little undermining of it that goes on all the time from the opposition.
The biggest barrier, just to be a broken record, it would be poverty, as far as I'm concerned, and that is very much associated to the history of colonisation in this country and land disposition and resource disposition, and therefore the inequity that plays out to this day. So I strongly agree with the Minister on the point around recognition of Te Tiriti o Waitangi. But there's also those points around kind of the structural underinvestment consistently and the trade-offs that are made between the way that we kind of conceptualise our economy, trickle-down tax cuts and other ways. So as far as the Greens are concerned, this is why it is really important that we do have that removal of the kind of administrative burden and the means testing and the bureaucracy that is involved with getting access to care and support. So you will have seen, hopefully, our proposal around universal dental care in this country, which we also know has a return on investment of approximately $4 per every dollar that is invested. Again, a massively important preventative issue. 13,000 New Zealanders land in our emergency rooms every single year as a result of escalating dental ill health issues. But yeah, long story short, to cut to the chase, this is about the social determinants. This is about ensuring that everybody in this country has access to meaningful choice and is recognised as having inherent dignity, not because they are good, but because they are human, in the words of my colleague and friend Golden Scarman. And for us, that looks like the guaranteed minimum income paid for by a wealth tax on the top 0.7% in this country. For that, we can deal with these issues, but we can also pay for free dental care.
Sure. So I think the biggest hurdle to health outcomes is actually health workforce. I can build an Eden hospital, who's going to staff it? We could do free dental, who's going to staff it? And also actually raise the question as to why is there such a small proportion of dentists participating in the safety net we do have at the moment? Why is that? If we're going to nationalise them and say now you're all going to be part of a national health service, should chat with them first to see if that's going to work for them. Health workforce. We've talked about policy. I've talked about policies here today around alcohol and education. You've got to come back to where are the arms and legs who actually do this. And so in my mind, our biggest hurdle at the moment, these are all good things. You need a plan, you need a strategy, but you need a health workforce who can actually deploy it. I think that's the biggest hurdle for health at the moment.
Kia ora. Well, thank you very much to all of you. I wonder if we could get a round of applause for all of the panel. Dr. Ayesha Verrall, Chloe Swarbrick and Dr. Shane Reti. Well done to all of you. Excellent panel, very good.